What if your body warned you about a heart attack 30 days before it happens? Most people believe heart attacks strike suddenly without notice, but clinical research tells a very different story. Many patients report experiencing warning symptoms days or even weeks before a major cardiac event. Unfortunately, these signals are often ignored, misinterpreted, or mistaken for stress, aging, or minor illness. Today's video could save a life, maybe yours, maybe someone in your family. You will learn 7 scientifically recognized early symptoms that may appear up to 1 month before a heart attack and what they mean inside your body. Watch carefully because several of these signs are subtle but medically significant. Let's begin. Understanding heart attacks. A heart attack, medically called myocardial infarction, occurs when blood flow through a coronary artery becomes critically reduced or completely blocked. The most common cause is atherosclerosis, a gradual buildup of cholesterol plaques inside artery walls. This process develops silently over many years. Before a full blockage occurs, the heart muscle begins receiving less oxygen than it needs. This state is called myocardial ischemia. During this stage, the body often produces warning symptoms, signals that the heart is under stress. Large observational studies published in cardiology journals report that a significant number of patients experienced early symptoms days to weeks before hospitalization. Recognizing these warning signs early allows medical intervention before permanent heart damage occurs. Now, let's examine the symptoms one by one. 1. Unusual or persistent fatigue. One of the earliest and most commonly reported warning signs is unexplained fatigue. This is not ordinary tiredness. It is persistent, overwhelming exhaustion that appears without clear reason. You may notice sudden drop in energy, difficulty performing routine activities, feeling drained even after rest, weakness without illness. Medical explanation. As coronary arteries narrow, the heart must pump harder to circulate blood. This increases energy demand while reducing oxygen delivery to body tissues. Clinical observations. Studies have shown that many patients, particularly women, reported severe fatigue weeks before a cardiac event. Important distinction. Fatigue linked to heart stress typically worsens over time rather than improving with rest. When unexplained exhaustion persists for days or weeks, it deserves medical attention. 2. Chest pressure or discomfort. Early heart-related chest symptoms are frequently mild, brief, and intermittent, which is why many people ignore them. Possible sensations include pressure or heaviness, tightness, burning feeling, mild squeezing sensation. Unlike the dramatic pain seen in movies, early warning discomfort frequently comes and goes. Physiological cause: reduced blood flow temporarily stresses heart muscle cells, producing discomfort signals. Clinical importance: recurring chest pressure, even if mild, should never be dismissed as simple acidity or muscle strain without evaluation. Any repeated chest discomfort warrants medical assessment. 3. Shortness of breath. Breathing difficulty during normal activities is a major warning sign of cardiovascular strain. You may experience breathlessness while walking short distances, difficulty climbing stairs, feeling unable to take a full breath, sudden decline in exercise tolerance. Why it happens: when heart pumping efficiency declines, oxygen delivery drops, and fluid may accumulate in lung tissues. Research insight: shortness of breath frequently appears before severe chest pain in many patients. If daily activities suddenly feel physically demanding, this change should not be ignored. 4. Pain radiating to arm, neck, jaw, or back. Heart-related pain does not always remain in the chest. It may radiate to left arm, both arms, neck, jaw, shoulders, upper back. Neurological explanation: nerve pathways serving the heart overlap with those of nearby regions. The brain may interpret cardiac pain as originating elsewhere. Important pattern: pain may be dull, spreading, or persistent rather than sharp. Many individuals seek dental or muscle treatment first, delaying cardiac diagnosis. This referred pain pattern is a classic but frequently misunderstood early warning sign. 5. Cold sweats and clammy skin. Sudden sweating without physical exertion can indicate cardiovascular distress. Symptoms may include cold, clammy skin, unexplained sweating at rest, night sweats without fever. Biological mechanism: reduced blood flow activates the sympathetic nervous system, the body's emergency response triggering sweat production. Medical significance: cold sweating combined with fatigue, chest discomfort, or breathlessness is particularly concerning. This symptom reflects internal stress on the cardiovascular system. 6. Nausea, indigestion, or stomach discomfort. Heart-related symptoms are frequently mistaken for digestive problems. Possible experiences: nausea, stomach pressure, indigestion sensation, loss of appetite, upper abdominal discomfort. Physiological explanation: reduced cardiac output affects blood supply to digestive organs and stimulates the vagus nerve, producing gastrointestinal symptoms. Clinical observation: many heart attack patients initially believe they are experiencing acidity or food-related illness. Persistent unexplained digestive discomfort, especially when combined with other symptoms, requires evaluation. 7. Sleep disturbances or unusual anxiety. Sleep changes may appear weeks before a cardiac event. Warning signs include difficulty falling asleep, frequent nighttime awakening, shortness of breath at night, unexplained anxiety, sense of impending danger. Biological mechanism: cardiovascular stress activates hormonal and nervous system responses that disrupt normal sleep regulation. Patient reports: many individuals later diagnosed with heart disease described feeling that something was wrong long before diagnosis. Repeated unexplained sleep disruption should not be ignored when accompanied by physical symptoms. High-risk groups who must be extra alert. Early warning symptoms are especially important for individuals with established cardiovascular risk factors: high blood pressure, diabetes, smoking history, high cholesterol, obesity, family history of heart disease, age over 40. For viewers in the United States, where heart disease remains the leading cause of death according to the CDC, early awareness is critically important. Timely recognition of warning signs allows preventive medical intervention, reduces heart muscle damage, and significantly lowers the risk of long-term disability or fatal cardiac events. When to seek medical help. Seek medical evaluation immediately if you experience recurrent chest discomfort, breathlessness with minimal activity, multiple symptoms together, symptoms that worsen over time. Early evaluation may include ECG testing, blood biomarkers, stress testing, and coronary imaging. Prompt treatment significantly improves survival and recovery outcomes. Heart attacks rarely occur without warning, but the warnings are frequently quiet. Your body communicates through symptoms. Awareness transforms those signals into protection. Share this video with family members, especially parents, elders, and anyone with diabetes or high blood pressure. On this channel, our goal is simple: clear, research-based health education that helps you prevent disease before it begins, just like our videos on artery blockage, circulation, and gut health. If you value medically accurate health awareness, subscribe and stay informed. Your health knowledge today can protect your heart tomorrow. Stay aware, stay strong, stay healthy.